Okay, hi guys. I am Liz Baroker. I did my final community health project in Middleton, Wisconsin. And the sole focus of my project was hand hygiene among pre K and 4K students. I did my clinicals at Clubhouse for Kids, which is located right in Middleton, Wisconsin. And yeah, so so those of you that are not familiar with Middleton, well, obviously we all know community health nursing is huge, and especially knowing your population, um, that's at the heart of your assessment. If you're able to know your community well, you're able to provide better care. Community health assessments provide health agencies with knowledge to identify health needs of a population, and then they also utilize community health assessments to make decisions and make action possible. So like I said, we're highlighting Middleton, Wisconsin in this, and then hand hygiene among pre-K and 4K students at this daycare that I was at. So the presentation itself will include a windshield survey, community assessment. I'll identify the community's partners and resources in which I was able to get a hold of through this project. I'll go over my diagnosis, the objectives that I had during this project, the implementation, and then the evaluation. So Middleton, Wisconsin, it's located right in Dane County. As of 2010, there were about 17,442 people that called Middleton home. Middleton, Wisconsin has a lot to offer the community, ranging from great entertainment, recreation, jobs, community organizations, and resources. And I'll go over some of those as a part of my windshield survey. So as far as entertainment and recreation goes, the big thing that stands out in Middleton is Greenway Station. That is a hot spot for recreation in Middleton among visitors and locals. This is a shopping and dining mecca. It has a whopping 51 acres and plenty of dining options ranging from local restaurants to chain restaurants. The downtown of Middleton also has a lot of options as far as dining goes and shopping. Greenway Station itself is a very walkable area. It's in more kind of a commercial area of Middleton, but it's super walkable. There's lots of sidewalks around. However, if you're trying to get from like Greenway to the downtown area of Middleton, that would require a little bit of a commute, as there is a pretty major highway that splits Middleton right in half. But it's pretty short, maybe about 5 minutes or so. The very nice thing about Middleton, though, is that they do offer a free trolley system that goes around to a number of different stops. It's about a 30-minute loop altogether, but that takes you all over Middleton, and it also connects Greenway Station and the downtown area. Also, if dining and entertainment like shopping is not really your thing, there are 27 miles of trails and 50 parks in Middleton, which is pretty amazing considering that Middleton's a part of the greater metropolitan Madison area. So a lot of places like that don't really have a lot of outdoor resources, but Middleton definitely does. So as far as jobs go, there's plenty of areas to work in and around Middleton. Madison really is a short drive. It's maybe about 5 minutes away from most areas of Middleton. That's with good traffic. But other areas, I mean, we talked about Greenway Station, that has tons of restaurants and dining if you're looking to work in the service industry. Also, there's plenty of things to work in as far as healthcare goes. So there's tons of clinics around Middleton, especially in the more commercial area close by Greenway Station. There's holistic care clinics, ophthalmology, plastic surgery, pretty much any kind of clinic you could imagine working in as far as healthcare goes. There are no hospitals directly located in Middleton. However, just a short drive down the road, there is plenty of hospitals located in Madison. Other things that Middleton boasts as far as community organizations and resources, so Kiwanis, the Lions, Goodwill, VFW are all very active in the community. They also have a number of senior citizen centers kind of located in and around Middleton. And additionally, they have their own police department, fire department, and EMS. So as far as the community assessment goes, so we already had talked, as far as people goes, there's 17,442 residents as of the 2010 census for Middleton. Of that, there's 4,453 families in Middleton. Middleton is predominantly Caucasian, so they make up about 87.1%, followed closely by Hispanics at 5.6%, African Americans at 3.5%, and then Asian Americans at 2.3%. In Dane County, where Middleton is located, 96.7% of people claim to have health care coverage. Of those, 11% had Medicare and 7% had Medicaid. I was not able to find stats specifically related to Middleton, but I was able to find these related to Dane County, which Middleton is located in. So the leading cause of death in Dane County was cancer. On average, they had said about 670 deaths per year due to cancer in Dane County alone. It was followed by Alzheimer's, heart disease, and other unintentional injuries. The leading cause of morbidities were things like obesity and diabetes. So as far as obesity goes, there were 59% that were either considered overweight or obese in Dane County. And then diabetes affects about 17,600 people. That's just diagnoses. There's another additional 6,550 that have yet to be diagnosed in Dane County that they were averaging or guesstimating. The structure of healthcare, so there's about 46 primary care physicians in Middleton. On average, those physicians see about 1,247 patients. So as far as partnerships go that I had formed while I was doing this project, Miss Drea was the teacher that was in the pre-K and 4K classrooms. She was invaluable as far as resources and everything goes. I had never really been in a daycare or a facility that had young children, and I didn't know kind of what governing bodies there were when it comes to daycares. I actually did not realize that daycares were also kind of overseen by the state, and there are certain policies that they have to adhere to. So when I was first doing this hand hygiene project, my original idea was to set up a hand hygiene station kind of in the classroom that was very easily accessible to children. However, Ms. Drea actually had pointed out the fact that hand sanitizer or alcohol-based hand sanitizers cannot be within reach of children. That's a state policy that they have mandated for daycares. So she was very invaluable in, pointing me towards these policies and guidelines that the state has. If I hadn't had her, I would have came up with a project and implemented it, and it wouldn't have been able to go through anyway. She was kind of really, the guiding light to the project. And then, of course, my clinical liaison, Becky, she was awesome, super welcoming, very excited to hear my ideas. She's the clinical director of Clubhouse for Kids, so she oversees all of the classrooms there. She was really excited. She gave her feedback very willingly about things that she thought would and wouldn't work out among the kids. So she was another great partner to have on this project. As far as resources go, I already mentioned the state policies earlier. I would reference those in relationship to the ideas that I was going to implement. So that was huge, the fact that Drea had pointed those out. And then the children, too, of course, that was probably the biggest resource of all. Without kids, these kids, without their enthusiasm or interest in this project, it would have just kind of fell flat on its face. So as far as my nursing diagnosis goes, I had said that there was a knowledge deficit on the importance of hand hygiene and its role in prevention of illness among pre-K and 4K students at Clubhouse for Kids in Middleton, Wisconsin, related to lack of exposure on the topic. The main objectives that I had, that these pre-K and 4K students would be able to state why hand hygiene was important. They would be able to demonstrate how to properly wash their hands. They'll show motivation to want to learn about hand hygiene, and then they'll verbalize the understanding of hand hygiene. As far as implementation goes, due to the COVID crisis, I wasn't able to get all of this stuff off the ground, but I had planned on doing a small presentation on the topic, just to kind of bring to light the importance of it. I really wanted to, a lot of these kids maybe were like 3 or 4 years old. And they had probably never heard of hand hygiene before and why it was important. So I really wanted to do a very short, small presentation kind of on why it was important. And then I had little activities planned. So one of the things I had looked up was the fact that if you blow your nose, a germ can spread like 6 feet. So I had wanted to demonstrate that to the kids by grabbing a 6-foot rope and then having one of them stand up at the front of the classroom, and then I would have gone over all of the kids, just to kind of show what 6 feet is in relationship to somebody sneezing. Another activity that I had planned out was a hand washing activity, which involves taking a spray that glows under black light. You can spray that on kids' hands and then ask them to wash their hands, and then when they come back from washing their hands, putting the black light on just to show them all of the stuff that was left behind due to poor hand hygiene. After I had done the demonstration and those activities, I really wanted to set up a chart to track their progress, because you can't have hand sanitizers, alcohol-based hand sanitizers within reach of kids. I was going to have that be available to the teachers, and then every time a student blew their nose or if they were coughing into their hand, they would ask for hand sanitizer from the teacher because they would not be able to get to it by themselves. But showing the initiative to ask for hand sanitizer, I thought that was good. And then what I would have done was have a chart of all of the students' names, and then I would be able to give them stars for each time they demonstrated good hand hygiene and good knowledge of why it was important. So to evaluate this growth opportunity in the teaching among kids, I really wanted to evaluate their absences. There's a recent study out of Virginia, and it showed that class absences were reduced by 71% after proper hand hygiene was taught to students. So that's huge as far as absences go. So if we could look at absences among pre-K and 4K students and say, wow, there's been a significant decline in absences after this hand hygiene program was implemented, I think that would show that the project itself was a success. Obviously, to be successful at this, you really have to have a good amount of data beforehand. So, really making sure that you're keeping track of class absences and how many students have been called out. That's huge as far as like just having good baseline data as something to compare it to afterwards. If it was inconclusive and we didn't exactly know if it was super successful, I really do think that reiterating why it was important, sometimes kids' attention spans aren't the greatest. So, to really be able to bring light to this topic, I think it would be important to, just expose them more and, why is this important? Why do we do this? I really think that would be a good way to help reduce the amount of absences, and then also, really teach them about what the purpose is of this teaching, why it is so important. So I was really happy to do this project. I think it really shed a light on an important issue and opportunity for growth. When you're looking at this knowledge, it really does have the potential to save lives long term. And then just understanding the community and population, you're better able to treat them. I think that's the one thing that I learned the most out of this project and going to my clinicals and, being in this class, is just how important it is to know your community. And, just being a part of the community, going into this daycare was a very good opportunity for me, just to be able to see exactly like what these kids' knowledge was of hand hygiene beforehand, so then I could be able to, meet their needs while this project was going on. I think was really great. So yeah, that is the end of my presentation. Thanks for watching, guys.